Quadriplegia by Andrew Ducro. Hi, my name is Andrew Ducro. I'm doing a presentation on quadriplegia, and it's for HPR 2120. What is quadriplegia? Quadriplegia, or also referred to as tetraplegia, refers to a spinal cord injury or disease that causes paralysis in all four limbs of the body, including the trunk. The spinal cord is typically damaged in the cervical spine along the segments C1 through C8. Usually, the higher the spinal cord injury, the less functional you become. In quadriplegia, the level of injury is dependent on the location of the injury or disease. The higher up the injury, the less functional the person becomes. In vertebrae C1 through C3, individuals must require a ventilator to help them breathe. Most daily activities will require assistance. In vertebrae C5 through C7, individuals can typically move their head, neck, shoulders, and arms. Also, they can independently eat, shower, and get dressed on their own. Finally, in vertebrae C8 through T1, individuals are considered the most functional. There are two main types of quadriplegia. The first type is known as complete. In complete quadriplegia, individuals will experience total paralysis of all four limbs and total loss of motor function below the site of injury. An example of this would be a spinal cord injury to C3 in the cervical spine. In this type of injury, individuals will experience total paralysis of limbs below the injury point. The next is incomplete quadriplegia. Incomplete, individuals will experience partial paralysis with some motor function below the injury point. A good example of this would be somebody who experienced a spinal cord injury to C5 in the cervical spine. As a result, the person will experience paralysis of limbs below the injury point and may experience some movement and some feeling. Another good example of complete quadriplegia would be the celebrity Christopher Reeves. If you remember, Christopher Reeves is a famous movie star back in the 90s and is most famously known for playing his role as Superman. In 1995, he was involved in a horse riding accident. He hit his neck and became injured and it became a complete quadriplegic injury that resulted in total paralysis from the neck down. As a result, Christopher Reeves later developed the Reeve Foundation, where money is raised and research is done to combat paralysis. Some current statistics regarding quadriplegia are the following. Car accidents are the leading cause for quadriplegia. About 275,000 people suffer a year from a spinal cord injury. Of those spinal cord injuries, 47% have quadriplegia. Of those 47%, 82% are men. There are almost 13,000 new cases each year. First year costs average around $1 million. Since quadriplegia leaves most people sedentary, other health complications can arise. Of these, loss of bladder, pressure sores, spastic muscles, and respiratory problems can occur. In this first activity, you will practice a simple breathing exercise. This is to help strengthen the diaphragm and allow for more oxygen to be circulated throughout the body more easily. In people with quadriplegia, diaphragms are usually affected and breathing becomes a big challenge. So if you will, click on the link and follow the instructions to the activity. In quadriplegia, the severity of an injury or disease can play a major impact in the cognitive characteristics an individual show. In some individuals, there may not be any cognitive characteristics or delays shown at all. In others, however, delayed memory or delayed problem-solving skills have been shown to come about. Another characteristic individuals will show is difficulties with speech. Again, everybody is different, and this needs to be assessed on a case-by-case basis. The behavioral characteristics of quadriplegia can be the most difficult to encounter, especially if you encounter an individual who is new to quadriplegia, either through disease or injury. The person may experience a hard time dealing with their new limitations. They may experience depression, and they may even become angry. Finally, we move into the psychomotor characteristics. These characteristics depend on the location and the completeness of the spinal cord injury or disease. The completeness, if you remember, refers back to the complete or an incomplete injury in the spinal cord. Complete means total paralysis, and incomplete means partial paralysis. In C1 through C4, almost no movement of the limbs is present. Individuals will require a breathing ventilator to breathe. When there is a spinal cord injury at C5, there is also little to no limb movement. The individual can breathe independently though. In C6, C7, the individual can typically move their arms and shoulders, and they may even be able to drive an adapted car. In C8, the individual is probably the most functionable. They can move their arms and shoulders, and they can even grasp objects and release them in their hands. Now, here are some special considerations when working with somebody with quadriplegia in a physical activity setting. For individuals with a spinal cord injury in the cervical spine, C1 through C3, physical activity can become a challenge. Individuals with an injury at C1 through C3 have very limited movement. A technique called passive physical therapy may be used. This is where the physical educator will physically move the client with quadriplegia, move their arms and legs to help circulate oxygenated blood through their body. This will prevent muscles from atrophying and prevent pressure sores from developing. Also, many individuals with quadriplegia carry external bladder bags. These bags must be checked before physical activity. Also, another thing to consider is to be mindful and respectful of other people's feelings in the activity setting. One sport that is becoming very popular in the adaptive sports world is wheelchair bowling. This sport has become very popular amongst people with quadriplegia and paraplegia. People enjoy wheelchair bowling because it is not complicated, it's easy to understand, and it is easily adaptable. Individuals that are not as functional with higher injuries on their spinal cord can use a bowling stick. This is an adaptive piece of equipment used to assist with pushing the ball down the lane. For our final activity, we're going to see what you remember from the PowerPoint. What type of spinal cord injury results in total paralysis and loss of function? A true and false question. A person with a spinal cord injury at C1 in the cervical spine can drive an adapted vehicle. Finally, name at least one health complication associated with quadriplegia.